For my project this semester, I chose to complete some research on child abuse in nursing. I chose this topic originally because my mom was a nurse in the ER, and child abuse cases were part of the reason that she decided to quit emergency nursing because she did not feel that the hospital that she worked at educated them enough on how to handle these situations. Since I'm not sure where I want to work yet, it's very important to me to be equipped to work everywhere and be able to handle all situations, including child abuse. As I completed my research, I also realized how prevalent this problem is and how hard it is for people in healthcare to recognize child abuse. You think anyone who doesn't notice it must be blind, but it's truly much harder to recognize than you would think. It's also very difficult for nurses and other people in healthcare to proceed in reporting child abuse or suspected child abuse for reasons that we will be discussing later. The research that I completed was done to be able to identify some of the barriers that prevent healthcare workers from reporting suspected child abuse. The only theory that was mentioned in my research was the theory of nursing practical, which was used to explain power relations between the genders. This theory supports the statistics that will be mentioned later about the roles of the different genders in abuse cases. For this project, I had 6 articles that I looked over and kind of broke down in order to get my information. There were 5 qualitative studies and 1 quantitative study. Of the qualitative articles, there were some descriptive, exploratory, correlational, and some cross-sectional studies. The methodology of these qualitative articles included questionnaires, structured interviews, and in-depth concept analyses. The quantitative study that I used was a retrospective exploratory study. It was completed by analyzing old reports of child abuse and studying the ways that the cases were handled, as well as the age and gender of the victims and the suspects in these cases. After reviewing these research studies, the qualitative studies revealed that the main reason healthcare workers gave for not reporting suspected child abuse was because they did not recognize the signs and symptoms, or they just weren't completely certain that what they were seeing was child abuse. Another reason that healthcare workers gave for not reporting child abuse was that they weren't completely sure of the protocols or the steps that should be taken in order to complete the report. The lack of knowledge in the signs and symptoms and the protocols are very important topics to touch on because these can easily be corrected with classes and training sessions. There's also always that fear that the child will face more and maybe even worse abuse after the healthcare worker does complete a report. The healthcare worker may also face consequences if everything is not done perfectly, and that could also be a fear that they have as well. Another article focused more on identifying the patterns of gender and age in child abuse. This study revealed that more boys than girls suffer neglect. About 41% of those that do suffer neglect are 3 years old or younger, because at that age there are more needs to be met. Sexual abuse usually occurs in boys 6 years old and up, and approximately 68% of the time, women are responsible for the abuse, which is interesting because you wouldn't think that the women would be the aggressors. And this is also supported by the fact that in familial cases, 64% of the time it's the mother that's responsible. Though you should always rule out child abuse, these statistics are important in helping healthcare workers to recognize possible cases of child abuse. Some of the limitations to these studies include that some of the studies that used interviews as a method of gathering data only completed the interviews one time. It's preferred to interview more than once to ensure that all of the information that is obtained is accurate and to make sure that all of the appropriate information is obtained. Convenience sampling was another limitation. There was no rhyme or reason. It wasn't even random. It was just they collected data from whoever was the easiest to get to, and this often ended up being samples in which the results could not be generalized. There were also very small sample sizes, which can cause similar problems. The author recommends completing follow-up studies with management because many of the nurses reported relying on their managers for input before submitting a report. It's also recommended to ensure that all nurses are comfortable with dealing with child abuse cases so that they're able to handle them in the right way. Getting the healthcare workers comfortable means educating them and training them on how to deal with the situations until they're certain that they can handle a child abuse case on their own. My personal recommendations include trying for more random sampling to be able to generalize the data a little bit more. And I think it's also important to include more men in the samples, considering more and more men are working as nurses and in healthcare in general. In conclusion, it's very important for nurses to be able to confidently recognize child abuse symptoms and have the knowledge to approach the situation in a professional manner. It's important that they know that no matter what happens afterwards, it's a part of their job to report suspected child abuse. They should also be educated on the steps that need to be taken in order to file the report with all of the information that is needed. With the growing numbers of child abuse cases, nurses and other healthcare professionals need to be fully equipped to deal with these situations. And these are my references.